Good evening, everyone. I'm Mary Archer, President of ACT, Addenbrooke's Charitable Trust, and it's my pleasure to welcome you to this, the 2022 John Addenbrooke Lecture. Over the past 2 challenging years, we've continued to raise funds and support our great hospitals, Addenbrooke's and the Rosie, launching one of the first emergency COVID response appeals very successfully. And last April, we launched our Buy Addenbrooke's a Robot appeal. So a surgical robot allows surgeons to undertake minimally invasive procedures on patients, which allows them to recover more rapidly. And a new robot will enable over 1,500 more patients per year to benefit from this innovative technology. Under normal circumstances, we'd be welcoming you in person to hear the John Addenbrooke lecture, but we've taken a cautious approach because of the importance of keeping COVID out of the hospital, and so this is running as a virtual event. During the evening, you'll hear from 2 surgeons and from Ashley Shaw, the Trust's medical director, about the new surgical robot and the work that it will enable us to do here in Addenbrooke's. Before I pass you on to Shelley Fake, ACT's Chief Executive, I just wanted to offer my personal thanks to you all for joining us this evening. Some of you have already fundraised or made a gift towards the robot, and we thank you very much. And I know we all look forward very much to the time when we can gather together in person to celebrate the arrival of the new robot and the new work it will enable us to undertake here at Cambridge University Hospitals. But for now, I'd like to pass you over to Shelley Fake. Thank you and enjoy the evening.
Good evening. What a great introduction from Dame Mary, and many thanks to you, Mary, for that wonderful and helpful introduction, which will make my job so much easier. I'm delighted to be here with you and with my colleagues this evening to share with you more about the robot and our campaign to bring a surgical robot to Addenbrooke's Hospital. We're sat in St Catherine's College in Cambridge, and behind me is the bookcase from John Addenbrooke, who in his will back in 1766 left a very thoughtful and kind pledge that has led to us having the wonderful hospital that we have today for the residents of Cambridge and all of those who benefit throughout the east of England. So it's a pleasure to be here. I'm going to tell you a bit more about the activity we've got going on in ACT. We're doing lots at the moment in terms of preparing ourselves to fundraise for the Children's Hospital, the Cancer Research Hospital, supporting the hospital in general, but really bringing home this robot, which is our current focus and ambition. This event is being recorded and will be shared with our supporters after this evening. We're going to be using live captions this evening, so hopefully that will record things well for you to see and for those that may follow up afterwards. We'll also be using a Q&A function, so at the end, if you do have questions, please do share those so that we can try and get through them. We've had some submitted already and we'll be trying to get through as many as we can throughout the evening. I do have to give you a content warning because we will be discussing surgery, and shortly we'll be showing you a video where there are glimpses of surgery that my colleagues have undertaken. So really a massive thank you and welcome for being here. Let me start by showing you a video about robotic surgery at Addenbrooke's Hospital. Thank you.
In normal surgery, it is usual for us to open up the patient to get to the area that needs operating on.
This means patients take a long time to recover.
Robotic surgery changes all that. A surgical robot means we can make smaller incisions and be more precise.
Importantly, it allows patients to recover within days so they can get home more quickly.
We need a new surgical robot as this will help transform the care of our surgical patients with less invasive surgery. With a new robotic system, our surgeons at Addenbrooke's will be able to innovate and make our surgery better.
Using a surgical robot gives us the opportunity to offer this keyhole surgery to more patients.
Urological cancers like kidney, bladder and prostate cancer, colorectal cancer patients, patients with cancers of the gynecological organs, patients who have liver or pancreatic cancers, and those with cancers of the head and neck area would all benefit from being offered robotic surgery.
It gives you better access, and it can get into the nooks and crannies that surgeons cannot usually get into without making big incisions.
It's an immersive, three-dimensional, stable view. The surgical robotic instruments are specialized instruments that have wrists and are angulated, and these can bend and move much more than a human hand can.
It means that we can offer operations that would have been done usually by a big open cut, and so it means that the stay in hospital is much shorter, and it means that people are getting back to their normal activities at home, their working lives much quicker. One of the main problems has been that we've had to delay a lot of surgery, we've had to cancel a lot of surgical operations, and so we now have quite a big backlog of patients awaiting both cancer and non-cancer surgery. One of the main reasons that a robot will help us to clear that backlog and deal with any future problems with COVID or other diseases like this is that patients will be in hospital for a much shorter period of time.
The surgeries that I do, using a robot will make me more efficient. It will be better for my patients in terms of how long they spend in hospital, and it will allow me to get to tumors in areas that I would not ordinarily be able to reach without much bigger procedures.
The benefits to the patient for that are smaller wounds, which are less painful, quicker recovery, and a shorter stay in hospital.
It was really awkward for my family to come and visit me because they're in Worcester, whereas if I'd have been at Addenbrooke's, my family could have stayed over. It was just very traumatic being in an unfamiliar place with unfamiliar surroundings and being so far away from everybody. Please help Addenbrooke's raise some money for a robot. It would make surgery for people so much better in the future.
Thank you.
Thank you.
Thank you.
Thank you.
So that's the inspiration behind tonight's event. Our campaign has inspired many to make significant donations. We set out with a target to raise 1.5 million, and I'm delighted to say so far we've raised and have pledges of 1.25. So we just have 250,000 to go, and we're working very hard to close that gap, because the sooner we can get the robot, the sooner we can help Addenbrooke's and the patients that come through the hospital. So our panelists are going to help, I hope, explain more about the benefits and why this is so important to Addenbrooke's and the community that use the hospital. So I'm delighted to introduce Dr. Ashley Shaw, Medical Director at Cambridge University Hospitals, Mr. Seong Liao, who is a consultant in kidney and pancreatic liver. Oh,
liver
there we
and
go.
pancreatic surgery.
I had to get something wrong, didn't I? Sorry, Seong. It's because he was trying to protect me from having to say a very tricky word. Go on, help us out, Seong.
Thank you.
And also Professor Grant Stewart. So why don't I let you all introduce yourselves in a bit more detail. Tell us more about your roles and what you do at the hospital. Let's start with you, Ashley.
Good evening, Shelley. Good evening, everybody. So I'm the medical director. My name is Ashley Shaw. I'm a radiologist by background, so I look at X-rays and CT scans, principally related to cancer. And over the past 4.5 years, I've been the medical director. So that means that I'm responsible for quality and safety at Addenbrooke's. I'm responsible for all of the doctors' professional activities, and I'm also responsible for all the research and medical teaching that goes on at Addenbrooke's. in addition to infection prevention and control, which obviously has been quite a big task over the past few years. So those are the things that I do on a day-to-day basis.
That's a lot to do on a day-to-day basis, Ashley. And how about you, Grant?
Yep. Hi, everybody. Hi, Shelley. Grant Stewart, Professor of Surgical Oncology at the University of Cambridge. So I'm the professor with responsibilities for cancer surgery and cancer surgery research. I'm also a consultant at Addenbrooke's Hospital. I'm a urological surgeon and I'm a kidney cancer surgeon. And currently I use the robot we currently have at Addenbrooke's, and I'll tell you a bit more about that as we go on in the evening.
Okay, thank you. And I know that you've been busy today. You had a 3-hour surgery, so
yes, yeah, recovering from that.
We're very grateful that you've come along to talk with us all tonight. So thank you. And Seong.
Hi everyone. I'm Seong Liao. I'm a consultant liver and pancreas surgeon at Addenbrooke's Hospital. The majority of my work is in treating liver and pancreatic cancer. And the operations I deal with are highly complex and often fairly major operations for patients.
Okay, and I know that yesterday your surgery was 8 hours long, so we've been talking surgery already this evening, and I'm going to try and extract from the team some more stories to really give you that insight about how important the robot is to them and the work that they're doing. So maybe I can start with coming to you, Grant, even though you've worked the hardest out of all of us today. Let's give you that one. Can you explain for our audience as simply as possible what robotic surgery is and who will benefit from the
Sure.
robotic surgery?
Yeah, so as you saw in the video, a surgical robot essentially is a device that holds the surgical instruments for us and moves the surgical instruments for us. So I think you saw that on the video with the arms of the robot holding the instruments. They looks a little bit like one of those car painting robots that you used to see on the television years ago, and it hangs over the patient. The arms are moving and controlling the instruments on the inside. But it's what's called a master-slave robot. So a lot of patients ask me, is the robot doing the surgery? And the answer is no, I'm still doing the operation. But you're sitting next to the patient, so you're disconnected from the patient, which is a little bit disconcerting as a surgeon who's used to standing right next to the operating theatre, touching the patient and doing the operation on them. So you're a few meters apart. And you're using a console that you look down, which has a 3D viewer, gives a fantastic three-dimensional view, and using very fine finger toggles to move the instrument. It's a remarkably easy system to use straight away. So you'll remember that we for quite a long time since the 1990s had keyhole surgery using straight instruments, they're a bit like knitting needles, and they have fixed ends, and they only move in certain directions, and it makes the surgery quite tricky to do. With robotic surgery, we still have those long instruments that go inside the patient, but they have wrists on the end that allow the instrument to move in a range of different directions, just like the human wrist does. And so it means, I think, as you saw Ekpemi, one of my colleagues, say, that you can get into the nooks and crannies that otherwise it's very challenging to achieve. I've put people onto the robot when it's being used as a simulator, and within a couple of minutes, they've been able to pick up the sugar cubes or whatever we're trying to train them to use the device. Whereas if I put you onto a simulator using standard keyhole surgery instruments, you'd struggle to do that. It's very difficult to get the depth perception and use the instruments. It's much easier to use them with the robot. So essentially, it's a device that is controlled by the surgeon, but is doing some of the very intricate maneuvers with the wrists of the instruments and being controlled by the operator.
So I guess the benefits of laparoscopic surgery with a bit extra because of the extra movement that you can have and the control you can have.
That's right. So still using these tiny incisions, a centimeter along, to give you that keyhole surgery, but allowing you to take on much more advanced procedures than we're able to do with standard keyhole surgery. And that might be because you're trying to do stitching on the inside of the body, which is exceptionally difficult to do with standard straight keyhole surgery instruments. With the wrist, it's almost as if you're handing the needle from hand to hand. It's remarkable. Or in the case of, you saw Ekpemi Arune talking about head and neck surgery, there it's because she normally has to cut into the facial bones to access the parts of the body where her patients have cancer. But with the robotic system, she'll be able to use the natural orifice, the mouth, to access those areas, but of course use the tiny instruments to be able to get in there to do it, which is impossible to do any other way at the moment, actually.
So we're hoping that this surgery, you talked about the fact that we have a robot already that's predominantly used for urological cancers. We're hoping to extend this. Now, I know that you two have been leading a group of consultants and surgeons within the hospital, which we call the Robotic User Group. And that group has been coming together to look at the benefit that having the additional robot would have and what that would bring. Do you want to tell me a bit more about that? Sion, would you like to expand on that?
Thank you. So let's perhaps focus on the patient in the first instance. Patients who undergo robotic surgery has a benefit of having complex operations achieved through small scars, as mentioned. With small scar, they will have less pain. And less pain, they will have less complications. And that results in shorter hospital stay and potentially less requirement of intensive care. Perhaps majority of my work is dealing with cancers of the liver and pancreas. Let me give you a perspective of a patient with pancreatic cancer. And for them to undergo a pancreatic resection, it's a major undertaking for them. It's literally a marathon journey for them. And with robotic surgery, there's a chance, and there's a good chance that the patient will recover faster, essentially making this marathon journey a lot easier for them, and therefore they could move on to the next stage of their management. For instance, they can get onto chemotherapy sooner. And the benefits of the robotic system is not just for the patients, but for the surgeons. As mentioned, there's tremendous benefits. For me, as a pancreas surgeon dealing with very major operations, the view I get from the robotic system is astounding. And it's, for a surgeon, I cannot operate if I cannot see. And the view that I get with robotic system is right down to minute structures. And when I can see those structures, for instance, if it's a vessel, I could stop them before they start to bleed. And the result is a bloodless operation, potentially better clearance of a cancer, and at the end of it, better oncological outcome for the patients. And we talk a little bit about training of a surgeon. The robotic system, with its fingers and its arms, is literally small, miniature surgical hands in a small operating field that allows us to achieve complex tasks. And with that has the ability of us increasing the precision of our surgery. And in my particular interest, resecting or removing pancreas cancer allows me to remove the cancer safely while avoiding major vessels. And that almost certainly will increase the safety of an operation. And in addition to that, let's talk about surgical training. In terms of training a surgeon, the robotic system is natural to the surgeons, and it's well recognized that using a robotic surgeon will shorten the learning curve of complex operations. In fact, with the user-friendly robotic system, it takes a strain out of a surgeon for prolonged complex operation. Inadvertently, that will actually increase the shelf life of a surgeon. And therefore, the impact of the robotic system is far wider than just simply the patients and the surgeons, but has a lot of downstream beneficial effects too. Over to you, Shelley.
So I mean, I think there's lots of benefits, and we'll carry on talking about that throughout the evening. One of the critical things that you've been doing in your robotic user group is identifying new areas. And I think, Grant, there's 6 new areas that we hope.
That's right, Shelley. So We've been fortunate in my specialty of urology to be able to offer robotic surgery for quite a number of years now. In fact, robotic surgery really hit the mainstream probably around about the year 2000, when prostate cancer operations started to be done with robotic surgery. And that's because that's an organ that's deep in the pelvis of a man. It's very difficult to get to unless you do an open operation and a cut. And now globally, the vast majority of prostate surgeries to remove the prostate for cancer are done with a robot. So urology has led the way, and so followed kidney cancer surgery, where we just remove a lump from the kidney and repair the rest of the kidney. So we're not having to remove it, and that's got a lot of benefits to our patients. And also bladder cancer surgery, where when we need to remove the bladder for bladder cancer, we can now do that with robotic surgery. Our robot at Addenbrooke's, the existing one, is the busiest robot in the UK, apparently. So it's used often 6 days a week. There's very little time to service it and give it some TLC. So we work it very, very hard in urology. The downside of that is that we can't currently offer the benefits that I see in my patients day in, day out to Seong and my other colleagues across the different disciplines in the surgery. So we need to have ACT help us buy an Addenbrooke's another robot, because we want to introduce robotic surgery to liver and pancreas surgeons, to colorectal surgery patients, to head and neck cancer patients, to patients with cancers of the gynecological organs, the ovary, the cervix, the endometrium, the womb, and also to ladies who have problems with benign gynecological problems like endometriosis, which is a huge problem and completely reduces quality of life dramatically. And it's going to be a big benefit to be able to offer surgery in that domain with the robot. And of course, in my own area, in urology, we want to expand what we're currently able to do, because I'm able to offer robotic surgery to some of my patients, but not to others. So yeah, we're really hoping we can get this across the line.
It's interesting that you talk about the existing robot, because of course Addenbrooke's Charitable Trust supporters helped us to buy that robot for Addenbrooke's quite a while back now. So it's great to see that the evolution of that is growing, and actually the sooner we can get the robot in place, the sooner we can start to treat some of those other patients that deserve to have this faster and effective approach to recovery. So I'm glad you mentioned that. Give me a plug and a thank you to supporters for that previous help. But actually, we've got the busiest robot in urology. We've got 6 specialities we want to get through this new robot. So I can kind of guess what the benefits are to Addenbrooke's, and you and I have talked about it at length, but why don't you just share with everybody a bit more about how important this is?
Yeah, so thanks, Shelley. So the most important thing to us is that we need to treat our patients, and we want to give our patients the best treatment that we can, whether that's in medicine or surgery. And I think it's very clear now, it's becoming very clear that in several areas of surgery, the very best treatment that you can offer someone is through robotic surgery. And the benefits of that, as we've heard from Grant and Seong, is that our patients from Cambridge and the wider east of England get a shorter length of stay. They get back to their own bed, making a recovery, where hopefully the food is better than it is in the hospital, making a nice speedy recovery and with fewer complications. So we get them into hospital and we get them out as safely as possible. And as Seong said, with a good cancer margin. So we're not leaving any cancer behind, because we're able to do that, and without having to damage other tissues on the way in. So that's being able to offer as many of our patients as possible the very best treatment. And we've got more patients now who are on our waiting lists than we've ever had. After the last 2 years of the COVID pandemic, as it's been widely said on the news, we have large backlogs of patients across many specialties. We have been focusing in the first part of our recovery on those people who have cancer and who have the most urgent need for surgery. And we've been focusing on the people who have been waiting the longest. But there is a huge number of people out there who still will benefit, both who are currently on our waiting list and who will be on our next waiting list. And this again enables us to treat those patients well and quickly, to get them in, to move them through the hospital. And then I think the final thing is we want to attract the best staff, and the best staff in the NHS, as within any sphere of work, want to work with the best equipment. So our surgeons, if we want to attract the best surgeons to Cambridge, we need to be able to offer them the best equipment so that they can in turn offer the best treatments to our patients. And this is what we would like to do. We'd like to attract the best doctors, the best surgeons, the best nurses, the best operating department practitioners. Everyone wants to be part of that excellence that we can then offer and be proud to offer the people of Cambridge and beyond.
And I think it's fair to say that it's not just about what the robot does for those patients and the staff that work with it. It's the fact that it's the knock-on effect to all of the other functions and departments as well that is super important. So, you know, I think there's been a time where departments have been islands within the hospital, but actually COVID's brought you a lot closer together, and people are working together, and the impact of one strength can ride through all those
Absolutely.
other departments.
If there are fewer complications, then you need to do fewer CT scans afterwards to check what whether there's been a complication. It's as simple as that. If the patient's gone home faster, there'll be fewer blood tests to do. The laboratories are a little bit more freed up. Everything the people doing the blood tests can get to the others faster. The nurses have fewer people to actually deal with on any given day. So everything feeds upon everything that you can do. If you improve one part of a system, it does have knock-on effects for the whole other part of the system. And as I say, it will enable us to give better treatments, and then to start to do research in these fields to be able to take the robotic development even further.
A good example of this shortening of stay, Ashley, is when we went from doing our kidney surgery with an open approach. So I had to go from open surgery directly to using the robot, and for the operation to just remove the lump and repair the rest of the kidney when it's done through an open approach, the average stay would be 4 to 5 days. With the robotic approach, I would say 50% of my patients get home within 24 hours, so on the first day after the operation. And as you say, they're much happier in their own bed. The food, you know, is more to their taste, shall we say, rather than saying it's better. And, you know, much less risk of catching any infections that in the hospital. You know, we've had patients, I recall, patients that have had learning difficulties who were extremely anxious about being in hospital, and that short hospital stay has meant for a much happier experience. Paradoxically, the short hospital stay makes them happier about their experience with Addenbrooke's than if they'd been with us longer. So, and as you say, less complications. It's very rare for us now to require an HDU bed. And hopefully when you start Sion doing this, you'll see the same, because I know you use a lot more HDU beds in
so that's specialty. The high dependency unit.
Yes,
just remembering
I'm sorry, yeah,
that not everybody's walking the corridors of Addenbrooke's, thankfully.
If I can add to that, one of the beauty of our program here is that I foresee there'll be more collaborative operations being done. Let me give you a classic example. For instance, a patient with colon cancer spreading to the liver. We have colorectal surgeons who are robotic surgeons. We have liver surgeons who could deal synchronously with the disease. So the benefit of that is clear. If the patient could have one single operation operated by 2 sets of surgeons during the same sitting. And that avoids the patient going to 2 major operations, instead having one. And that would clearly translate to perhaps a better outcome for patients, because it's not just the physical insult of major operation, it's the mental insult on the patient as well. As I mentioned earlier, any major operation is a marathon for these patients. So essentially you get them to do one single marathon rather than two. So if you could get that, that clearly will have impact on the care that we provide. So I think the beauty of our approach, in addition to the fact that we have at least five new services. Obviously, it's the sixth being urology, bladder, and kidney is an ongoing program. There will be a lot of cross-learning between surgeons, and that is historically surgeons obviously are kind of isolated in compartments. But what we have now is it's a fertile ground for a lot of collaborations, not just from the technical development. Potentially, we could learn about things that we can learn better to manage a certain disease process by learning from colleagues from other specialties. So there's a lot more benefits from just simply the operations.
That leads on to quite a good and insightful question then. I mean, you've studied for years to become doctors. You know, you're practiced in opening up patients and navigating through vessels and all sorts. How easy is it for you to learn robotic surgery, and how are we going to make sure we buy you this robot that the training and that can be done quickly and people can be safe? I mean, you said at the beginning, Ashley, your job, quality and safety.
Yeah, I mean, I think what we need to remember is that the surgeons who are training today or are expecting almost to be, in many of those specialties, would almost be expected to go somewhere and do a fellowship learning how to do robotic surgery. Now, whether that's within simulation, virtual reality type settings, or whether that's an actual patients. And that's becoming the new standard of what surgeons do. Previously, that was laparoscopic surgery, as Grant said, to 2 or 3 large straight sticks like knitting needles, and that was a much steeper learning curve. And each generation of surgeons is learning new techniques. I think the key here is what we're seeing is, and I've actually had to go on one of these myself, and I'm not a surgeon, but actually these are very, very easy pieces of kit to pick up. And once you have the underlying, so you need the underlying surgical skills, you need to know the anatomy, you need to know where to cut. Anybody can cut. Knowing when not to cut is the skill. So when not to do the operation, what not to take out. So what we're seeing here is that it's the latest iteration of the technology, and not only is it better for the patients, it's easier for the surgeons to pick up and learn. So this is something that the surgeons will learn at a much faster rate than they did when we introduced laparoscopic surgery 20 years ago.
Yeah, that's right. You're wasted in radiology. You should be a surgeon, actually. But so we're going to have a couple of scenarios. As Ashley says, our current trainees are training in robotic surgery and will be oven-ready robotic surgeons by the time they graduate from their training. For those of us that are already consultants and having to develop the skills as consultants, it's as Ashley says, the knowledge of the disease, the anatomy, where to cut and where not to cut is the key thing. The devices, these devices are so simple to use after an intensive period of training with very clear mentorship and a close-knit team that makes sure that everything's done extremely safely, mean that you can make progress rapidly. So Seong, I know that you've got a plan in place about how you're going to get your team trained, but I'm very confident that it will be smooth, just as it was when we started kidney and bladder surgery a few years ago.
You're at the front of the queue to go first when we get this new robot, aren't you, Seong?
Well, one of the things that for us to set up new innovative programs in surgery, in fact, Addenbrooke's is one of the best places in the country to do this. It's one of the best places to have any surgery in terms of safety and outcome, and that's clear. And one of the things that has been well described is that for surgeons, conventionally, the approach is open surgery. Making that transition from open surgery to robotic surgery is a lot easier and shorter as compared to years ago when we were making that transition from open surgery to laparoscopic, which is the straight stick needle operations that Karan was mentioning about. So you can imagine that the reason for that, the primary reason for that is because the robotic arms are natural to a surgeon. And that allows us to perform the operation just like an open operation, apart from making that big incision. So the whole idea is that when a patient can make that transition seamlessly, the outcome naturally be better. And in fact, training the next generations of surgeons to be easier too. And it's mentioned again and again, and I think it's crucially important for us to attract the best talent to Cambridge. And when we do that, we train them, we retain them, and almost certainly they'll contribute to the ongoing quality service that we provide to our local community. I think that's the ultimate long-term benefit of a robotic system.
I mean, I think it goes without saying, doesn't it, really, that it's so important that we can start to do this. And longer term, Ashley, how many robots are you hoping that we can?
Well,
how many do you need for your backlog?
Well, no, I mean the backlog will take a number of years to clear, but this is an ongoing program. I can fully envisage that in if we were sitting here a decade from now, I would imagine that probably closer to 10 robots would become the norm, because once these things start to become more popular, once they become the standard of care. So at the moment, this is still, whilst they're growing, is still cutting edge technology. I think if we get fast forward 10 years and we get much better robot technology, all surgeons will be trained, this will become standard of care in 10 years for many more different types of operation. So there are still some things that you would still do in a traditional way, largely the things that are actually on the skin surface, but things that are deep in the abdomen and possibly in the future within the chest as well, you will start to see more and more surgeons picking this up. The technology of the robots will become more nuanced, they'll become more joints, etc. They'll be able to twist through more degrees. And I would imagine in 10 years' time, we may be looking at 10 robots. But I think it will be one of those things that we start to see on an upward curve. But I think what we're trying to do here is get really ahead of the curve here so that we can start, we can build on a good start on that journey and really start to expand it to more surgical colleagues. Yeah.
So Grant, you've probably had the most experience of robotic surgery. How do patients respond to the offer of robotics? I'm assuming you give them the offer, the chance of robotic surgery versus traditional methods. What's your experience of patients and how they respond to that?
Very, very positive. I mean, the majority of my patients are exceptionally pleased when I'm able to offer keyhole surgery. And when I say that, and that will be with the assistance of the robotic surgery device, many of them are already aware of the technology, and certainly if they're not, they go away and, I mean, we give lots of information and counselling in our clinics anyway when we're talking about the options, but they'll go away and they'll often have a look on the internet, on YouTube, and see how this thing works. In fact, often when the patients come into theatre, they'll ask us to tell them a bit about the device before we give the anaesthetic. So there's a lot of interest. They're generally very pleased. As you may have seen on some of the videos that we've recorded with some of our fantastic patients, they're amazed by how rapidly they can recover. Yeah. So I would say it's universally been very, very positive experience for us offering and them accepting the offer of this. I've not yet met anyone that was concerned about the technology, if you like, and what it means after careful explanation of how the system works.
Great. Well, I think we've covered quite a lot of ground here. Shall we open up to some questions that we've had? So, right. Hello, Rupert Warden-Hill has asked a question. He's in year 7 and has been a fundraiser for ACT for 4 years. Rupert, you're my favourite person of the evening. Thank you. Thank you for taking the time to read my question. My question is, when the robot is operating, can other surgeons be working on the patient at the same time? Or is it only the person, one person and robot at a time? Now, I think I'm going to give that one to you, Sion.
Thanks, Shelley. Well, Rupert, most of the time, a set of surgeons who operate in one particular field, the benefit of that is that you take the operation stepwise. Well, it's clear if you need 2 sites of operating, most of the surgeons would obviously take it stepwise, address one particular region before moving on. It's very rare that we do 2 things synchronously, because if you do 2 things synchronously, you double the risk for a patient. You want to take every single operation safely, stepwise, before you move on to the next stage. If that clarifies the question. Thank you.
And probably worth just adding for Rupert that when we're doing robotic surgery, although I'll be at what we call the surgeon console, looking down the viewfinder and using the finger controls, I will have an assistant right by the patient, standing right by the patient, changing instruments, maybe from a pair of scissors to a grasper or such like, or putting needles inside so I can grab the needle and then use it. And also to do some extra things like sucking out any fluid or whatever to clear the view. So there are people stood right by the patient. We're doing the same operation in this scenario, but just so you know that that's how it works in the operating theatre.
Is it fewer though, or is it roughly the same?
I would say actually you probably can manage with 1 person less in the theatre team in general. So yes, and I can do most of my robotic surgery operations with an experienced surgical care practitioner who's not a doctor, not a surgical trainee or another surgeon. So
definitely not me. I'm just saying.
Well, you know, you fancy, but so yeah, in general, it's certainly not more.
Yeah.
Just to add to that, a surgeon has 2 arms. A robotic surgeon has 4 arms.
Right.
So each one of them contributing to the operations, almost like a well-orchestrated symphony.
Okay.
So essentially, if another example to that is that conventionally, I would have the main operating surgeon and assistant. You have two surgeons with 2 brains. Each would maybe do their own thing, but in a robotic surgery, you have the sole control being the operating surgeon, coordinating those arms and achieving the exposure that is required to achieve a particular step. And that clearly has the benefit of executing the operations far more efficiently as compared to a conventional approach where you perhaps would have to tell your system what to do. So that's the beauty of a robotic system, and which I think with time that will even get better when we have technology that allows us to communicate to other theatre staff remotely. They could visualize the operation far more clearly. They could all contribute to the operation in their own ways. And therefore you have a system, a team that is completely seamless in achieving the operation safely for that patient.
So Rupert, if you're looking to be a surgeon or a fundraiser, you get in touch with me and we'll make sure you get to see the robot at some point. Thank you for your question and for being here tonight. So some more questions I'm reading from the screen. Is there a possibility that the robot could be used in areas beyond the 6 already discussed, such as cataract surgery or in pediatric surgery?
Yeah, so not in cataract surgery, certainly not the type of robot we're talking about tonight, but pediatric surgery, yes. So just as we do standard keyhole surgery in tiny infants, yeah, and older kids, we can also use the surgical robot for pediatric surgery.
So who knows, we are going to be raising funds to build a children's hospital. Maybe we should be focusing on the future of robotic surgery for pediatrics there at the same time. how will my surgery benefit with robotics rather than normal surgery? And what is the improvement in recovery? We have covered a lot of that this evening, but I think we were talking a bit earlier about, you know, you'd done a 3-hour open surgery today, you did 8 hours yesterday, Siong, and I was like, oh, well, your time would be reduced. And you put me in my place and said it won't be a shorter time of surgery necessarily, it'll be more about the recovery of patients. So, but it will be easier on you as surgeons, I would expect.
Yes, so well, and Siong mentioned that earlier, that so we have to look after our surgeons. You know, we spend a lot of money training them, and if we wear them out before their due date, before they get to their mid-60s, then we lose some of that sort of useful time of work, and open surgery, even laparoscopic keyhole surgery is tiring. It's physically demanding. With the standard keyhole surgery, you're standing a little bit sort of tense and fixed. And a good example is that I do a lot of running, like Ashley.
Does Ashley run?
He runs. He's done some marathons.
Did he run the marathon for ACT?
Yeah,
oh, okay.
He did. Yes, he did. So I do a lot of running, and when I've done 2 keyhole surgery operations, or maybe an open operation and a keyhole surgery operation, if I compare that to a day when I've done 2 robotic surgery cases, the evening run is much easier and much quicker, because I've been sitting down in a natural position, looking at down the viewfinder, just using my wrists, and it's much less fatigue on the surgeon. And I think that's an important sort of side benefit to all of this. We'll keep our doctors going for longer.
And get more of them to run the marathon.
Yes,
I didn't know you were a runner, but we'll talk about that.
That's much faster than I am.
Does he? Okay. Okay, so let's try and pick out a patient where robotic surgery has made a real difference. Let's try and get a bit more patient insight here. Can you think of?
Yeah, I think for the patients, I mentioned earlier about how patients they will recover sooner, and I think with minimally invasive surgery with a smaller scar, patients clearly will have a far more comfortable stay during the operation. I'm always amazed by how a patient, for instance, with pancreas cancer going for a Whipple's operation, which is a 8, 9, 10-hour operation with massive scar, and they remain stoical and uncomplaining and stay in hospital, and some may have complications. But with robotic surgery, the hope is that a lot of that will be reduced. And the important thing is that the outcome, for instance, difficult to treat cancer like pancreas cancer, the benefit is not just surgery. The combination with surgery and chemotherapy is critical. And many of our patients do not get onto chemotherapy because they have such a rough time after a major operation. And that's critical. If a patient can undergo robotic surgery, recover sooner, and they will have the strength to fight on the next marathon, which is the chemotherapy. I think that's absolutely critical for these patients. The evidence for combination chemotherapy plus surgery is clear, and that promotes survival.
So the opportunity for stronger outcome is huge.
Absolutely. I mean, I remember a couple of sort of stories. I told you one a moment ago about a patient who really didn't want to be in hospital. But I've had a few patients where I've had to do an operation on both kidneys at separate times. And one of my patients had an operation which I had to do with the older fashioned open surgery, big incision, a lengthy recovery. Even after 3 months, still not quite back to normal. All of the muscles that allow you to sit up straight, not healed. Then I said, listen, I'm sorry, we need to do an operation, same operation on the other kidney. But the good news is that we now can do this with keyhole, with the robot. And, he couldn't believe the difference in the shorter recovery, shorter time in hospital, but critically, a much shorter recovery at home, able to get back to work, back to being a productive member of society rapidly. The other thing that struck me was that the big cuts that I used to have to make are very disfiguring. A cut in the side of the tummy, which is where I had to make this to access the kidney, you always end up with a bit of a muscle bulge. The muscles never recover fully. And particularly in young patients, I found that really quite challenging to know that I was leaving them with that. And so I've had a number of young patients in their 20s and 30s who I've been particularly pleased that I haven't left them with a scar for essentially the vast majority of their life, which has been great for them, and I've been delighted to be able to offer it.
I think when we spoke about this very early on in the campaign, I was shown some video footage of the very large incision in the side, and it has stuck with me. So I'm glad we're not sharing that and showing that tonight. So I love talking to you guys, and I have to say, for the benefit of the audience, that I am blessed to have the job that I have, that I get to work with really great and inspirational people like you guys every day. And I think Rupert, who fundraised for us, everybody who fundraises for us, everybody that gives a gift to ACT, gives it because of the experience they've had of such great care at the hospital. And as I say to the hospital staff most of the time, my job is made easy because you do such fantastic work. So a really big thank you for that. And I know that you have been on at me to get this robot and to raise the funds. You've been doing all you can to help us do that. You've appeared in posters around the city of Cambridge, on bus stops. Ashley's run the marathon for us. It's really incredible. And I think that we've probably got quite a large audience here tonight who have listened in just because of the respect they have for the work that you do and the work that the hospital does. And Ashley, you made a throwaway remark about being responsible for infection control and that over COVID. And I know just how hard you've worked, but just what a leading example that's been to other institutions. And I'm really proud of Addenbrooke's for everything it did. So I really hope that we can raise that extra £250,000, get you this robot, get it in quickly, let's get moving. If we go over, we'll buy you a second one. We'll build new hospitals. We've got phenomenal supporters behind us. So I don't know, Ashley, as the medical director, is there anything you'd like to sort of say before we close?
Yeah, I mean, I think I consider myself quite fortunate to lead Cambridge University Hospitals, because it has the best. I think I consider some of the best doctors, surgeons, nurses, staff anywhere in the country. And the reason they're here is because they want to deliver great care. And that's a reputation that's been built up over the 250 years since John Addenbrooke set up the hospital just up the road from here, where we are in St. Catherine's College. And one of the key partners in making us great has been the people of Cambridge, and the way they've given money over many, many years through Addenbrooke's Charitable Trust and its various previous iterations. And that's one of the things that has helped us in this really difficult time to stay at the forefront, is to know that the people of Cambridge are absolutely with us. And I think this is, again, us going out to ask once again, please, if you can donate, if you can fundraise, if you can do anything you can to help us to move forward in this next step on the journey of keeping Addenbrooke's at the forefront of the best of medicine, the best of surgery for local people and for the people of the East of England and beyond, that would be a hugely beneficial thing, and couldn't be more grateful if you could get on and do that.
So thank you, everybody, for being with us tonight. Thank you, Ashley, for making the ask. Thank you, Grant. Thank you, Seong. I know you've had a long and busy week, so we do appreciate you being here. And a massive thank you for joining us this evening. I hope you've enjoyed the lecture. I hope that it's not too long before we can all be together in person for the next John Addenbrooke's lecture. In the meantime, have a great evening, keep safe, and we look forward to seeing you soon. Thank you very much for your support.